started out well last Thursday.
Good, yay!
Just keep celebrating.
All right. We'll celebrate all month long.
That's right. That's right. Thank you all again, everybody.
You're welcome. Thank you too. Thank you. You're the one that we say that you're the one that keeps everybody afloat. So we thank you.
If I do, that's good.
I found the names of them.
Okay, go ahead, Barb.
Yeah. Okay. Now this lady had the Epstein-Barr virus for weeks, sometimes months.
Okay.
And her husband, somebody suggested to take the TH1 stacked with LL37. It's actually two peptides. One of them is TH1. The other one is LL37. She was well in 3 days after fighting it for months.
Wow.
Can't say it will work for everybody, but it's been a miracle for her.
That is amazing.
Is it injections or oral?
You know, I think like I'm using LL37 and it's an injection. I'm not sure about so many of them are coming out with pills now, and put it on a message to you.
Okay, thanks. Please do. I'll get that over to Dr. Tennant as soon as you send that, so we can put that in there, because that's really interesting. That's good information to have. Thank you very much, Barb.
You bet.
Welcome, everyone, and thank you for joining us for Season 5, Episode 11 of Doc Talks with Dr. Forrest Tennant and friends. We're glad you could be with us with your favorite show and all of your favorite family members. Dr. Tennant has a great show ahead of us, and we've got our special guest, Bob Payne, with us tonight, and a lot of exciting things ahead of us. So, Dr. Tennant, it's all yours. We'll let you take it away. Thank you.
Thank you, Jamie. Tonight, I want to address two issues that are of national importance and are, you would think we wouldn't even need to bring them here. But we have as a lot of you know, a dysfunctional, controversial, disabled system to treat people with pain. And I'm going to start off the meeting here with one of two letters that I've received here just in the last few days. Now, the first one, I'm going to read to you. It says, "Dear Dr. Tennant, you referred me to Dr. X for pain management, and I have to tell you that he has changed my life by providing the best pain control that I have had in 6 years. I have a 30-year history of L5S1 arachnoiditis, causing L2, 3, and 4 symptoms like bowel, bladder, and sexual dysfunction, along with L1, L5 bulges, stenosis, and overall disc desiccated, causing chronic and severe pain and bilateral peripheral neuropathy. It is so advanced, I realize I will lose the ability to walk sometime soon. My main concern is the loss of bowel, bladder, and sexual function, which I said many years ago that I would not want to live when those things occur. Wanted to ask you if there are any treatments to counter the S2, 3, and 4 symptoms, and do you think the spinal stimulator could help those issues, as well as the peripheral neuropathy? As always, thank you so much for helping those who were left behind due to the opioid crisis." Now, I have contacted this person, and here is the amazing story, but I'm afraid it's universal almost. It's everywhere. And here it is. This man believes that since he got good pain treatment, he didn't have to do anything else. Okay? In other words, I asked him, well, what are you doing for your arachnoiditis? He said, oh, well, I thought the pain treatment took care of it. He's not even taking vitamin C. He's not taken any corticosteroid. He's never had an Epstein-Barr test, never heard of it, has no idea what his hormones are, never heard of a peptide. In other words, he has felt good because he's taking an excellent pain regimen, and I happen to know his doctor is #1 in pain control. But here is the message, and I'm going to ask both Dr. Ibsen and Dr. Guess to respond to this until we go to the next situation. Whenever I go to a pain clinic, and I try to visit one every 2 or 3 months somewhere, I will go in and sit and I'll go in the waiting room and I'll start asking patients, you're here, are you getting good help? Most of them are. They're getting good help. I said, what is the cause of your pain? Oh, they said, well, I don't know. I hurt here and my leg hurts, my shoulder hurts, my head hurts, my back hurts. But I mean, have you had a diagnosis? Well, no. Here is the issue. If you don't, if you're getting good pain control, and there is this myth that good pain control is curative of your disease. It is not. Now, you got to have good pain control to have enough energy and enough diet to help deal with this. But in this man's case, he has allowed probably Epstein-Barr, probably some autoimmune disease. He's never taken any tests. And so he has no idea why he's having these problems. I happen to know that his doctor is first-class pain doctor, but he's a symptomatic pain doctor. He doesn't know anything about spinal disease. He doesn't know anything about viruses. He doesn't know anything about peptides. And so what we have is that people need to be in pain treatment, but they've also got to diagnose and treat their underlying cause of the pain. Otherwise, they may do like this gentleman, wake up one day and want to commit suicide. Their bowel doesn't work, their sex function doesn't work, they're now in a wheelchair, and their life is short. Because I don't know where this came from, but it has gone on now for a long time that pain treatment's all you need. Symptomatic pain treatment, you don't need to diagnose or treat your underlying disease. Okay, that's the issue. And this podcast needs to make it clear you've got to do both. Okay, and there's good people out there that are trying to do both ends, but everybody's got to do that. Scott, you out there somewhere, or Mark, one of you come in, and I'd like to have you weigh in on this issue that people think they don't have to treat their underlying disease. They can just get pain treatment and that's all.
Yeah,
Mark,
yeah, I'm here. Well, I'm just learning this in the last 6 months from you, Dr. Tennant, and even longer from like Rhonda Posey and using the supplements and the peptides. I have a patient who's had a recurrent viral infection and is on an antiviral now, and her baseline inflammatory system is better on the viral thing and has an EBV reactivation level. She's going to be on an antiviral on a regular basis and just stay on it. So it's great to learn these things. I certainly didn't know them. I don't think anybody did more than a year ago. So I think, we're doing a good job of spreading the word, and this is Nobel Prize winning type stuff, Dr. Tennant. So I'm grateful for you and everything you've done for all of us.
well, thank you so much. Scott?
Yes, sir, I'm here.
You as working on the pharmacy end, you obviously have seen this belief among patients that just pain relief is all they need.
I'm going to go more on my palliative care experience than my pharmacy experience on this one. And I think just, a while back, we didn't really have any other choices, but the whole concept of just treating the pain and not treating the underlying condition, you've asked many times, how do you think we got to this whole opiophobia crisis that we're in? And I think that's a contributing factor. We just wanted to throw pain medications at people. And in the 2000s and the decade of pain, that's what we did. And as high doses as we thought was necessary, but we didn't treat the underlying condition. We didn't treat the inflammation. We didn't try and alleviate anything. Even, again, palliative care, there's no cure, but we can help relieve some of the causative factors. And I think that's how we got to the place we did. We got to start looking at.
Yeah, well said. Well said.
One more thing. I've been at Dr. Neil Anand's trial in Philadelphia the last 2 weeks. And they are going after him for overprescribing non-opiates.
Yeah, I
kid
want to
you
come
not.
back.
He has his patients take diclofenac cream and anti-inflammatory, and those who have reflux from the anti-inflammatory, he's got them on Prilosec, and he has them taking sleeping medications and muscle relaxers. And the patients don't want to take those; they just want the pills. So, and he is instructing them vigorously that you got to take these other things. And the feds have accused him of overprescribing opiates, but they're also claiming he's overprescribing these other medications. So I'm a little bit discouraged by this, seeing that if you respond uh, to the federal opiophobia by trying to use complementary medications, and then they accuse you of fraud for that, I think they're just determined to kill the whole specialty of pain management and let these people die. I don't know. I'm confused by it. I'm going to. Dr. Anand shared with me these pearls. I'm going to clutch these pearls for a second, and describe to you what these prosecutors are basically saying to the jury is Dr. Anand doesn't care about you. He just wants to prescribe all this other medicine to you, and what you really need is the opiates. I mean, it's a total flip from the other cases, because they know they have no case, so they're doing anything they can to besmirch him. So other doctors on the call, be aware that the federal prosecutors are now judging you how you practice medicine. And Dr. Timothy King evaluated Dr. Anand's practice. A undercover video of his nurse practitioner and medical assistant, and saying this isn't medicine, and it's a classic medical examination on a recurrent follow-up visit. So we're up against some evil shit here. Excuse my French. And he's going to win the case, but we've got to inform people that they got to take the whole program, not just the pain pills.
Yep.
And
Mark,
here's where,
I'm going to read this next letter because last week you brought up an issue that I got a letter that's just classic based on something you heard in that trial, which was chronic pain didn't have any tissue damage. I'm going to read you this next letter, which tells you some kind of propaganda is out there. This is a letter from a young man. It says, "Dear Dr. Tennant, thank you for the update. However, there is more to the picture. The mind controls the body. Control the mind at a consciousness level, and you can control the body. Think if I fully believe that I can reverse my condition by adjusting my diet, and I fully believe that, then it will work. But I have to be 100% in belief. Any doubt is a problem. What is your thoughts on my curing my arachnoiditis with mind control?" Now, one of the things that I just wrote down here, a couple of things, and Mark, I want you to particularly talk about how this came up in the trial. We have seen nationally, in national publications, we've seen it in trials, we've seen it in medical board hearings, all over, that chronic pain can be dealt psychologically, cured. Now, for example, I just jotted down here this evening half a dozen cases I heard from this week to dispel this whole idea that you could cure any of these cases with either mind control, or there's this foolish notion that pain is not generated by these tissues that are abnormal. Here's the first case: a man with metastatic prostate to the bone. Okay, you're going to cure that with psychotherapy? Here's a rheumatoid arthritis patient, crippled up in a wheelchair, both knees and elbows and hands very crippled. Are you saying that person doesn't have pain? And you can cure that person with mindfulness, or that they're catastrophizing and overemphasizing their pain? I've got a veteran I've been in touch with. He was in the Iraqi war. He's got half a leg missing. He's got a collapsed chest. Part of his face is gone. And his VA hospital tells him that acupuncture is the worst thing he can do, and just some kind of mindfulness, cognitive behavioral therapy will cure him. Okay, doesn't need any medications. And next one here, I've got a patient with a leg is swollen from hip to toe, fallen in an accident, a severe case of RSD or CRPS. Now, that leg hurts, and you're not going to cure that leg with a little mindfulness or motivation. In other words, and another one here, all the time I look at MRIs and see clumps of nerve roots stuck to the arachnoid lining. Are you going to cure that with mind control? Not going to happen. And we've seen in things like AARP, national magazines, economic magazines, that mind control and these psychological measures will take care of chronic pain. We don't need opioids. We don't need benzodiazepines. The mind will do it. Let's call it like it is. The mind does control a lot of bodily functions, but it doesn't control disease. Okay? I guarantee you that mind control has no influence over the Epstein-Barr virus. Okay? So, at any rate, Mark, last week you brought up, and everybody I've talked to this week can't believe that you heard in this trial that chronic pain is not associated with tissue damage. You want to expound on that a little more?
Well, yeah, that's what Dr. Timothy King said. Self-appointed um, uh, grand poobah of pain management that you've never heard of, and I never heard about him till this happened. I did find out that he is responsible for several of my friends being imprisoned, including Dr. William Bauer. And what I learned at the trial is facts don't matter. That opinions matter in the legal system. You can present facts all you want, and they just don't. You have to convince the jury that you're right with the facts that you have. People can't lie, and we've caught the prosecutors in lies, and Dr. Timothy King in lies, and all that. But they seem to have a long leash at which to fabricate things that will get people. It got Dr. Anand 30 years of prison, and he doesn't deserve that at all. So there's a lot of lying going on, and we just have to keep telling the truth to that in the cultural narrative as well as in court. And I think we need to. One thing I saw in the court is a little bit of coddling of defense witnesses that have flipped on Dr. Anand. There was this one lady who had a brain injury. She was in bed either 5 years or 10 years, depending on if you trust the record or the patient. Obviously, this patient has some incentive to testify against Dr. Anand, but he got this patient walking. He got her out of bed. She's walking without assisted devices, and she's testifying against him in the government's case against him. And I can't. It's hard to be with that kind of betrayal, and knowing that someone could lie. And have an opinion on testimony that, well, he's prescribing too much diclofenac cream, and that's obviously a problem. But yeah, he did help me walk, but screw him. I'm testifying against him anyway. So obviously that patient has an incentive. She must have committed some crime, and they're going easy on her. And the defense people are going very easy on those patients, and I wish they wouldn't. But apparently, from the standpoint of winning a case, you can't really get too assertive with patients on the stand because it looks like you're mean or cruel or something. But these people are harming my friend, and I'm really angry about it. The prosecutors are using patients, 14 patients out of 2,500 in his practice to testify against him, and they're all they're all under the thumb of the prosecutors who've basically given them an offer to fish or cut bait or testify for us or we'll ruin you. And it is a sick situation in our justice system, and it's now infecting our medical system because apparently the justice system is in charge of medical practice in America today. So yeah, I got some thoughts about that. As far as mind control, obviously, there are gurus who can lift something up from a distance or bend a spoon or something, but essentially the rest of us, we cannot control our immune system with our mind. However, we can control our attitude, which might have some effect on whether or not we're enjoying each moment that we have. So I'm not black and white about this. I'm saying that if I didn't have some training in how to deal with oppressive stress, and unfair situations and things that are out of my control, I would not be here today. I'd be dead by now. So what I have to say about this specifically is everybody on this call is a better expert than anyone else in the country on these things, because we're up to date and they aren't. And we just have to get them up to date as much as we can. And what I really saw and got some hope from is that several doctors came to Dr. Anand's trial. The prosecution did not like it. I wore my white coat in the audience. They didn't like that. And they tried to kick me out. And they tried to kick Susan out several times. And they just they're just win at all costs. And I'm just trying to term this with words that are suitable for fan consumption, because obviously it is cruel, unusual, capricious, arbitrary, and there ought to be a law.
Arresting doctors to see how their practice is, destroying their practice to see if it's effective, is the wrong way to do it. It's wrong. Stop it, prosecutors. Stop it, feds. Stop it, DEA. Stop it, boards of medicine. There's got to be a better way. You want to come look at our practices, just come through and look at it, and then make your decision. But don't send a SWAT team, don't steal all the records, don't abandon a bunch of patients, don't destroy people's lives, and then say, oops, sorry, my bad. Stop this shit. Stop it. Cut it out.
Doc, what do you make out of this?
Oh,
Marcus,
there's a whole lot to unpack there. One of the last points that Dr. Ibsen made about can we use our mind to control our pain? Maybe a little bit. We can certainly use cognitive therapy and that type of thing to help how we deal with the situation we're in. These people who say that we can, cure pain with just thoughts have totally ignored the whole receptor agonist theory of medicine and medications, from anywhere from the mu receptor for pain to the COX inhibitors for anti-inflammatory to the beta blockers for blood pressure to the islets of in the pancreas for treating diabetes and blood sugar. They're telling us that we don't have to do the whole receptor agonist theory of medicine that we all learned in school.
yep, absolutely. We have a guest interview.
One more thing about this.
Sure.
One more thing, Dr. Tennant.
Yeah.
They had a patient that was testifying against Dr. Anand, who initially came to him because of pancreatitis, chronic pancreatitis, and pseudocysts, and when she was in his care, he was treating her with opiates and the anti-inflammatory stuff and all that. They asked her what her dose of medications were. This is a lady who's diabetic from her chronic pancreatitis. They did not ask her insulin dose. They just asked her opiate dose. And that just shows how ignorant these young attorneys that work for the prosecutor's office, they think they've got some gotcha game going here, and that we've caught you in practicing terrible medicine, and they are not they don't have the training to evaluate the practice of a brilliant physician like Dr. Neil Anand, and that just chaps my ass. It really does.
And
that's all.
And so what happens here? And I've been following this case, Dr. Tennant.
Yeah, go ahead, Norm.
What they've been stumbling into, and I want people to look at an article we wrote. There is a brief that was filed by Dr. Russo, turned me on to it, a brief that was filed in the Ruhan case by the Physicians Against Abuse. And one of the key points in this whole discussion is the control. It's called scope of practice. The prosecutors nor law enforcement have no business in the scope of practice. So anytime they go back and say, dictate anything when it relates to medicine, is simply, it's a violation of law. And physicians, that brief that we put together addresses that issue of scope of practice. And what these guys are doing is, and they don't realize, because they're so stupid, they're here trying to determine the dosage of medication. They don't know the difference between a control medication and a non-control, but that's what they're running into. And this is where I think it's good for the defense in terms of Dr. Anand is really putting pressure, demonstrating to the jury that these prosecutors are so what Mark said, they're clowns. They're running around, little boys that are out of their league, just making up things. And another thing that we pointed out, and I think what you said was something that was very important. He said that mind control cannot control disease and disease state, and that is so key to this to this argument, this kabuki show that has been going on around the country. And so and there's one other thing that came out in this case is very interesting. They had some undercover agents came in and they brought these videos in, and it showed the normal practice going on. And they've been doing this, faking radiographs and faking whatever. So we came in and said, listen, this is nothing but a case of judicial Munchausen syndrome. It achieves the same effect that one who has Munchausen by direct or Munchausen by proxy. This is Munchausen by judiciary, because they get the same thrill in bringing these fake, going to a physician, faking their diagnosis, faking their radiographs, and giving this information to the provider. And eventually you will catch up to Munchausen syndrome. But we coined that phrase judicial Munchausen. And anybody who wants to look at what the progress of this case can go to You're Within the Norms. Dr. Ipsit did an excellent presentation. I think everybody needs to look at in terms of this thing is wrong and it's got to stop and those sort of things. So I just wanted to add that input in there.
Norm, thank you so much. You said one word there that I'm going to repeat, and that is this thing's got to stop.
Yeah.
I want to move on to introduce our guest, but I'd like to say anybody who's watching tonight or watches our follow-up videos, if when you read anything about how some psychological therapy is going to cure some serious disease like arachnoiditis or CRPS or cancer, get them to us. We want to expose this because it's time that we bring the truth out. I mean, we can't go on as a society with this kind of CRAP. Okay. Jamie, you want to bring our guest forward tonight?
Yes, sir. Be happy to. Mr. Robert Payne, I would love to introduce you to Doc Talks, but you have been with Doc Talks since the beginning, I think, other than maybe 2 or 3 shows.
Yes.
So welcome back. It's great
Thank
to
you.
have you with us. There
here
you
we go.
are.
Okay, Bob, you've been with us a long time, and we sure appreciate that support. And
You're
we're
welcome.
looking forward to a long relationship with you.
Right.
Can you go back a little bit? How did you get interested in pain problems, whether it's your own or whether it's your advocacy for the greater good? Can you start at the beginning? How'd you join us?
Jamie, do you want to play the video with a good answer for that, a 5-minute answer?
I would sure love to do that, actually. So we will go
thanks.
ahead, and you're welcome.
Yeah, I've had pain since I was 15 is the short answer.
That's right.
My guest today has the dubious honor of saying, I survived hospice. Join me in welcoming Robert Payne. Robert, thanks for being here.
Thank you for inviting me.
What put you in hospice?
Headaches since I was 15, almost every day. So I took the prescribed amount of pain meds, opioids. I did not read on the label that these were not to be taken with alcohol, so became a heavy social drinker. Was a high-functioning IT consultant, good accomplishments, happy clients, and about 2 years ago, I was in a hotel in Sacramento, stepped out of the shower and slipped and saw the floor coming up at me. I woke up in a 2-foot pool of blood. Didn't call the ER, didn't go to the doctor. I just thought, well, that's odd. But it happened about 2 weeks later, same hotel. And that time I took a selfie, but still didn't call the ER, didn't call 911. I was in denial. And then several weeks later, I had a third fall and finally went to the doctor. Took 5 vials of blood, sent them to the lab stat, said not only my eyes, but my skin were yellow. And next morning, he personally called my wife and said to take me to the ER. He said, oh, she was on her way to work, that she would take me about 5:30. He said, no, turn around. He has to go to the ER now.
Wow. And then what happened once you got to the ER? What was the
I was, thank you. End stage cirrhosis with ascites. I was in the hospital for several days, moved to inpatient skilled nursing for occupational and physical therapy. I was there for 3 months, in fact. Then I was put in home hospice.
And when you were in home hospice, how did you survive the situation?
Yeah, thanks for asking. The denial that had kept me from going to the doctor also kept me from thinking I would die. And I used Western and Eastern medicine. Hospital gave me morphine and fentanyl. And good news, bad news, that I did not have any alcohol withdrawal symptoms, didn't remember any of those. So haven't had a drop of alcohol since that day. The GI doc gave me 11 prescriptions, walking a fine line between keeping my liver healthier and healthier and not whacking my kidneys. And in the Eastern medicine, my wife put me on several prayer groups right away. The blood counts, the test numbers look better almost immediately, much faster than the prescriptions could have explained. I used hemp oil, CBD, massage, and other integrative medicine.
Congratulations. That's quite a feat. I understand you're putting all this into an amazing book.
Yes, thank you. Survivor Thrive Opioids. I'm finding caring people, about a dozen people have signed up from all over the country. MD, DO, chiropractor. They're caregivers also. We sometimes forget, and my wife was an excellent caregiver and representative, and in hospice, she was the primary caregiver. There are also alternative therapists, Reiki and music therapy and acupuncture. So coming
Quite a
together,
team.
yes, thanks.
Quite a team. Bob, we're out of time right now. Do you have any closing words that you'd like to tell us about?
Yes, as I did, I had the choice to survive or thrive, and we all have that choice. We're all worthy. We have specific things that we can do, and so the book does show additional things that any one person can do.
And we appreciate you. Please thrive and come back and see us soon.
Thank you.
Thank you, Bob.
Robert, then let's go back to a couple of basic things. First off, where do you live? Where's your home?
DFW, Texas, Dallas-Fort Worth, Texas.
Near Fort Worth, okay.
Yes.
And what do you have a pain issue of your own or your family? How did you get involved?
Yes, I had sinus and tension headaches from the time I was 15, almost every day. And my mother taught me not to settle for what that day a pediatrician might say in response to the symptoms. So she went ahead and took me to a neurologist and to an allergist. That was the answer in those days. And that worked. But they came back after a year or two, what I would now call level 7, 8 headaches and the associated lack of mental clarity, not being able to reliably promise much of anything. I would miss later in my working life. I'd be worth relatively little after about 2 every day. It continued. Here's something about psychological effects. The next time that they were really treated well was by a Philippine psychic surgeon, and had a 20-minute session. As you may know, the good ones of those are from a lineage that dates back to Jesus' time. One of the branches did follow Jesus' healing methods. I had a 20-minute session and I did not have another headache for 5 weeks. So,
And how old were you at that time?
At that time, I was in my mid to late 20s.
Mid to late 20s. And what did he do to give you some relief for that long?
He did a Philippine psychic surgery session. One thing I asked him about, and he said that negativity had crystallized in my forehead. And so he performed psychic surgery on it and took it out and washed it down the sink. I took other people to him in later years and they had the same wonderful results. So tonight someone mentioned that some gurus can do such things, and that is absolutely true. I put in a comment, in fact, 5 minutes ago that if Jesus walked into the room, there's no doubt that he could do that. It's just that it's a rare trait, and it takes meditating 40 days in the wilderness and all kinds of preparation. I've personally seen a genital herpes virus, and the practitioner, excuse me, I'll turn that off. That's an alarm to take a prescription, by the way. I'll just set it aside for now. And that practitioner happened to believe that she talked to the virus and said to it, you're not really sure what you're doing. In the long run, you're going to kill off your host, and then where will you be? And the lead virus said to her, well, we never thought about it that way. I'll talk it over with my pals here. And that went away. It was herpes. I was the patient. The practitioner was my wife after 3 trips to India. Now, those things are possible. The fact I'm alive is a miracle. In fact, after many years as an IT consultant, heavy travel, pain meds were not keeping the pain down below an 8, maybe 3 times a week.
Where was your pain at during this period?
Yeah, in the forehead and neck.
Uh-huh.
Yeah.
And has it ever been below the neck? It's always been in the head.
it's always been in the head, and over the years, it also moved into several areas of my back. In recent years, I've had MRIs that show canal stenosis in 3 locations. Yeah.
And have they ever established a reason why you had this, or a cause?
No, until I started coming to these meetings, and based on your general recommendations, had the MRIs, and the first one did detect kissing disease. I took that to my PCP, who's in favor of anything that helps patients, and he said, well, it's probably just that you kissed a girl when you're 17 years old, And I said, no, I said, let's go ahead and test 3 of the tests that you recommend. And they showed numbers off the charts. So definitely do have Epstein-Barr reactivated. Yeah.
And you had, on the 3 tests, were you positive on all 3, or which ones were you positive on?
Good question. Jeremy, I wonder if you can get that file to work. I'm finding the radiology report here. Here it is. So EBV nuclear antigen 600, EBV, ABVCA, IgG 600,
Is that visible,
EBV
everybody?
early antigen 105.
Yeah,
There it is.
Now, can you move it up a little bit on the screen, about an inch, half inch,
Let's see.
quarter inch?
Let me see if it'll let me, Doc. It might take
And the 4th one,
This is an excellent report to go over for people.
Okay.
right.
Okay.
Give me
This is really the panel that people need. Okay. Now I'm going to go down this quickly.
Thank you.
And before this is over, doctors, nurse practitioners, chiropractors, and patients will learn how to look at this lab and tell what it means. As a matter of fact, what I have done in my project is to be in touch with virologists, literature, reports, try to pull it all together to develop some practical, hands-on, down-home ways of dealing with this, because that's what I found has been lacking. Now, let's go up here. We're going to start at the bottom, okay? Now, at the bottom of this, you've got the Epstein-Barr antibody. It's called the IgM antibody. Now, that is basically for infectious mononucleosis. But we have found that about 5% of people with severe chronic pain disease have this. There are a handful of people that develop what's called chronic mononucleosis. It's rare, but we do have cases like that. Okay. Now I'm going to jump up to the top. It says EBV nuclear antigen AB IgG greater than 600. Normal is 22. So what that means is you're 30 times higher than normal, and your level is high, so high that the laboratory can't measure it. Okay. Now, what this tells you is that, and you gave us a history. You said you were sick when you were 17. How old are you now?
72.
Okay, 32.
72.
But between this time, you have reactivated your virus probably a half a dozen times. We don't know how many, but when your antibody gets this high, it means you've had multiple reactivations. Now, the second line, you've got what's called the, or the top one, the nuclear antigen. That's the one, that's the bad one of the bad ones. Okay. Now, that one carries the autoantibodies and means when it's this high over 600, you've got autoimmunity. Okay,
Yes.
that's what that means. Now you've also got down here EBV, early antigen antibody IgG. And what that means that on the day this test was taken, which was November 14th, 24, you had an active virus. Now, when you have an active virus, that means that that's the indication to go on an antiviral agent or an antiparasitic agent like ivermectin. In other words, everybody should not be taking antivirals. Only those people that have an active virus. If you were normal there, you could take all the antivirals in town. It wouldn't do you a bit of good. But you're based at least back in November, you should have been on a antiviral. You've also got autoimmunity. You're going to have to be on Toradol and maybe a ketorolac and maybe some peptides. And then the good news is you do not have chronic mononucleosis, but you do have the typical pattern of people, someone who develops severe intractable pain. And you will have to deal with this. Our show doesn't have enough time to deal with this. Our little handbook helps on this, but we're going to be going over
Yes.
this from now on. This is part of medical practice. And if you've got a doctor or a nurse practitioner, and incidentally, I'm really pleased with most of the doctors and nurse practitioners of America. They're catching on to this very fast. And
Right.
they're starting to realize that. Incidentally, I had a visit early this morning with a virologist who works for the federal government, and she's a virologist, and she's read our books, understood what it was, and now she's got a gastric cancer. Gastric cancers are one of the EBV causes gastric cancer, nasopharyngeal cancer, Hodgkin's disease, and lymphomas. About 2% of the world's cancers. So a person with your profile, you can cry about it. You can say it's too bad. You shouldn't have it, but it's controllable. Okay, we can control this, and you certainly aren't going to do it with your mind. You're going to do it, with a protocol. And I was tickled to death early on here in the show that somebody came up with a new one. We welcome all new things. Okay, it's early, and I'm convinced that a year from now we'll probably be using a whole different set of medicinals. So anyway, Robert, tell us how you're doing now. How are you functioning? Have you got a good life? Tell us about your life now.
Oh, I'm encouraged, but I always believe there's more anyone can do. I'm not able to work on my book. The rain is cloudy, and some days I can't get out of bed. I still drive. I can still take a short hike with my grandkids, for example. Let me interject that based on learning that I did have EBV in your sessions, I did talk to my PCP about ivermectin. He immediately wrote a prescription, and he knew a compounding pharmacist nearby. At that time, I was having level 8 headaches 3-4 times a week. Within 5 days, I did not have another headache for 4 weeks, another level 8 headache. So,
Hallelujah.
yes, ivermectin deactivated the virus. Yes, it did.
Let me say a quick thing about ivermectin.
Yes, thanks.
Ivermectin during COVID was very controversial. It
Yes.
has not been controversial with Epstein-Barr virus.
Right.
You can take a trial of ivermectin for a month, 6 weeks, 2 months to see if it works, but we've had no controversial feed pushback on ivermectin anywhere in the country. And
Right.
so the compounding pharmacists are getting to where they're making it. Highly recommended, and you can experiment with both ivermectin as well as valcyclovir or acyclovir. In other
Yes,
words,
I take that. Yes.
they're not independent.
Started to.
And we're starting to collect, case histories to figure out what works the best. But what we need from you, Robert, is to keep us posted. To hear that you went 4 weeks without a headache, we'll take that. Okay,
Yes,
it's
yes.
sold. Yeah. What else have you
Talk about
found that you think helping?
ivermectin.
Yeah.
The woman in Houston the EMT doc, ENT, ear, nose, and throat, who forced the FDA into a settlement. She's still very active on LinkedIn. The state medical board backed off on, so she has her Texas license still. So that's good news. I read that yesterday. State of Arkansas made ivermectin legal as an over-the-counter medication, and read yesterday or today that 10 states have legislation in their state legislatures to make that happen. Texas is one of them, by the way.
And what are they trying to do?
Trying to make ivermectin over-the-counter medicine.
Oh, good.
And they did that in Arkansas.
Wouldn't bother me any.
Right, right.
Yeah, we'll take that. But I do think that it's turned out to be an amazingly safe. It's labeled for parasites. EBV is a parasite, and it has not been controversial like when it was used for COVID. It's worth a trial for anybody who's got the active virus. Now, incidentally, there's another test for an active virus, and it's what they call the polymer chain reaction, PCR DNA test. But the early test is just as good. We do have on Amazon right now a little cheap handbook for about $5 on treating and diagnosing ABV and in pain conditions. That's worth getting. We've tried to keep it as cheap on there as we can, and that's worth getting, but it's also worth staying on top with these shows, websites, and anybody who's having some good success. Like I was tickled to death to hear about TH1 and LL37. We'll be checking into that. So, Robert, get back to us with anything that's helping or ideas you have. Okay? Yeah.
Well, Dr. Tennant and Ms. Sanchez, do we have 2 minutes to look at something more on this test from
We sure do.
LabCorp? And with the question, and
Go ahead.
on the third row, it's changed in the last month. So the EBV early antigen, ABIgG, had been, let me check.
I'll get it. I'll pull it up for you. One of your results was, I believe, in November, and one was in April 17th of 24, and then again 11. You had it again in November of 24. Okay, there's the results right here.
So for the EBV early antigen, it changed to 105. And that surprised me. And I don't know if anyone else here on the call has ever
What was it before?
thought about that. I should. It was
Yeah, the early antigen is the one that will change. Now, the other antibody
okay.
don't change much.
Okay.
Yeah.
That's the answer then. All right. Thanks.
But was the early antigen, did it go up? Did it go down? If you had
It went up from 100 to 105.
That's not
That's
enough.
my recollection.
Yeah.
Good. Good.
Yep.
I remember, Dr. Tennant, that you had talked about someday putting together training for doctors to get the word out. You thought it would take about 2 years to encourage a large number of doctors in the U.S. to order these tests.
Yeah, yes. My timeline is speeding up a little bit, I must confess.
Right.
The word on this is spreading faster than I anticipated, both here in Canada, UK, Europe. I don't know. I thought we were going to be in the wilderness with this, but it's turning out that I think that enough information has been out about viruses, and I think everybody knew something was wrong. Just like we talked about the person on the Payne program, we didn't. Dr. Ibsen well articulated it. We didn't have anything else to check out, so things are moving along pretty fast, and a lot of it's thanks to the show here. Okay,
Yes,
spread the word. Okay, I don't know
yes,
how we move things any faster, but if you got ideas, let us know. Okay. But the practicing nurse practitioner, doctor, chiropractor, osteopath, they're getting with the program pretty fast, from what I can see. Okay,
great.
and it's been generated by the patients. You know, one of the other things today, you can't turn on the television until you see a pharmaceutical ad. That's usually for some
Yes,
expensive drug that God knows who can afford it, but nevertheless, they're there, and so doctors are getting used to patients seeing something on television or in media and taking it to them. So that's back in my generation, we'd have frowned on any doctor about patients that brought in those things back in my day, but not now. Doctors today are used to patients coming in because they've learned something, and the doctor, if they don't appreciate it, get a new doctor. That's all I can say. Okay. Uh, Fortunately, we've got an awful lot of good humanitarian doctors, chiropractors, osteopaths out there, and they're they may not be getting much credit and aren't making much money, but they're dedicated. So
good.
yeah. So I can't. It's not all bad out there. We're making a little good humanitarian and scientific headway. Yeah. So
I taught a family practitioner about CBD and not that many years ago. At least he was open. Good.
very good.
One
Mark.
other thing I might add that is in that mystery 6 minutes is that when I was, let's see, in 2014, symptoms were getting worse. My eyes had turned yellow, and I still didn't go to a doctor. Started falling. By the time I did go to a doctor, he ordered tests, called my wife, he was a family friend, and told her to take me to the ER. And I was in the hospital for 6 or 7 days, skilled nursing for 5 weeks, and home hospice for 5 months. I survived hospice. Yeah.
Wow.
Again, partly because of prayer, partly because of the gurus. Yeah. Yeah. Oh, and talk about the thought process. I think I know that one thing I did every night, I thought to myself, well, I'm going to be a little better tomorrow.
Uh-huh. That's a good attitude. Yeah.
Good, good.
That is good mind control. I'm going to get better. We'll accept that one.
Yes. One anecdote there briefly. I was moved between wings of the hospital, and they said that if a given liver number didn't get better by the next day, they were going to have to send me over to a huge hospital in Dallas that had a lot of liver experience, had cirrhosis of the liver with ascites end stage. And so my wife talked to the hospitalist, and she said, well, how much did this number need to change before you can avoid sending him over there? And he said, maybe it's bilirubin, I'm not sure. He said, it needs to be above 40. So she worked on me that night, and the next day it was at 40. True story.
Well, really?
Yeah.
Well, you're out now. You've got a life. We're glad you're with
Yes.
us.
Thanks.
Going to have to sign off. We're out of time.
Yes.
Jamie, I'm glad you brought this young man to us. He's got a great story. Mark, thank you so much. Next week, we'll want further reports on the Anon trial. Scott, thank you so much for everything.
You're welcome.
Norm, your prescient
Thank you.
remarks are always great to hear.
Thank you.
We'll close this. We have an awful lot of people out there just lying about what works, what pain's all about, what disease is all about. It is tragic. But I would just say one thing, and I hate to even bring something this ugly up. There's something called the big lie technique. That was what Hitler and his people used to deal with the Jewish population in World War II. The big lie technique is when the lie is so big, it sort of sounds logical. We are dealing with people who are throwing around the big lie about opioids, about disease, about healing, and it is pathetic. And Dr. Ibsen has unfortunately described an attitude that's part of our government. And I think that we're going to want to hear more about this because it is not pleasant and it's not good news. Stick with us, keep us informed. Good night, and thanks again, Jamie, and thanks all of you for putting on this great show. Good night.
Good night, everybody. Good night, Dr. Santa.
Good night, everyone.
Good
night,
night, y'all.
Hey, Jamie, I want to hang out for just a second.
Okay.
And the good news I have, and it's not really news, it's just a hope. We had an impact on Dr. Anand's trial by having doctors there and people in the audience. So, you know, you had a huge impact on my trial with the Board of Medicine in February by sending in letters, showing up on the Zoom. And I think showing up at these trials is maybe going to be the way we shift this thing. Because the judge sees that Dr. Anand is not alone. There's 6 doctors in the audience. And that's a key thing. Hang on.
Hey, Mark,
I'm about to exit. Yeah.
what about Dr. Ruin? You know, he's still in federal prison in Texas.
Dr. Ruan?
Yeah,
Yeah, he
Dr.
is.
Ruin. And, you know, the Supreme Court asked them to bring it back down to the state court, the Alabama state court. Well, this jury was instructed to take out the good faith clause.
Wow.
Yeah. I mean, there's only so much judicial malfeasance that we can cope with. I guess the best thing is don't get in the system. But I do think that going forward, we've got to suit up and show up at these trials and make sure that these MFers don't get away with this shit anymore.
Yes.
Hey, I wanted to see something too, Mark, which is that reporting on this trial has been very, very, very interesting. And I try to get out a report every day. If you look at youarewithinthenorms.com. And we did a very interesting report on MME just recently, and it was by Dr. Nabran Dasgupta. And I spoke with Dr. Dasgupta, and he was so proud and so happy. He said this article captured the essence of what he's been telling people all the time, and he loved it and wanted it to go viral. Another thing I wanted to say is I had a chance to speak with Dr. Randy Lamentier, and he's in the same railroad process too. A corrupt judge, Judge Jackson, who outright said that that Wuhan stopped him from putting doctors and physicians and pharmacists, all of them in prison, and he said he was going to just ignore Wuhan. Unfortunately, what Randy said is they took that case to the Supreme Court again, and they rejected. They didn't take it up. So he's in a tizzy, but we can still continue to fight, get
Good thing
exposed.
I saw that.
Right. Okay. So I just wanted people to throw
Thanks,
that out.
Norm. That's brilliant.
All right.
Yes.
Yeah.
Thank you.
Yeah, I think everybody's got to read this MME article that Norm put out. It's brilliant.
Seriously, everybody. Well, we will
Thanks,
see you
everybody.
next week. Thank you so much. Same time, same place.
I'm signing off
Okay.
from Des Moines, Iowa.
Yay. Please
I
be
love you.
safe. And all
I
your
love
angels
you
are
all.
all
Be
around
safe.
you.
Be safe.
Thank you.
Love
Thank
you.
you.
Love you,
Love
Mark.
you
Love
guys.
all of you guys.
God bless you
God
all,
bless you.
family. Love you. You're not
Thank
alone.
y'all. Great show.
Just glad to
Yeah.
be alive with y'all.
Thank you.
Be
Night.
safe, Mark.
Thank you. Will
Safe
do.
travels, Doc.
Yes.
And everything.
Praying for you.